This video will help you understand the fundamentals of infectious disease epidemiology and transmission dynamics. We'll look at the major components that affect the spread of these diseases over the next 5 minutes. To begin, let's establish some fundamental principles. Infectious diseases are caused by pathogens like bacteria, viruses, and parasites. They can be transmitted from one person to another through various routes, including direct contact, droplets, airborne particles, and contaminated surfaces. The epidemiological triangle is a critical concept in understanding disease transmission. It consists of 3 key elements: the host, the agent, and the environment. The interaction between these elements determines the likelihood and spread of infectious diseases. Host factors include an individual's susceptibility to the disease, their immunity, and their behaviors. Certain demographics, such as age and pre-existing health conditions, can increase vulnerability. Agent factors involve the characteristics of the pathogen itself, including its virulence, infectivity, and ability to mutate. These factors influence the severity of the disease and its potential to spread. Environmental factors encompass the conditions in which the disease spreads. This includes factors like population density, climate, sanitation, and healthcare infrastructure. Infectious diseases can be transmitted through different modes, such as respiratory transmission like COVID-19, fecal-oral transmission like cholera, or vector-borne transmission like malaria. A crucial metric in epidemiology is the reproductive number, denoted as RO. It represents the average number of secondary infections produced by one infected individual in a susceptible population. If RO is greater than 1, the disease can spread rapidly. To control the spread of infectious diseases, various mitigation strategies are employed, including vaccination, quarantine, isolation, hygiene measures, and public health interventions. Herd immunity is achieved when a sufficient percentage of the population becomes immune to a disease, either through vaccination or previous infection. This reduces the overall transmission of the disease. In recent years, the world has faced the challenges of emerging infectious diseases like SARS, Ebola, and Zika. Understanding their transmission dynamics is crucial for effective containment. In summary, infectious disease epidemiology and transmission dynamics are complex but essential fields of study. By comprehending the interplay of host, agent, and environmental factors, and by implementing effective mitigation strategies, we can better control and prevent the spread of infectious diseases. Thank you for watching this video on infectious disease epidemiology and transmission dynamics. Stay informed, stay safe, and together, we can combat the challenges posed by infectious diseases.